Why are nerve stimulation settings crucial for bladder? Have you ever wondered how nerve stimulation can help with bladder issues? Understanding the settings for nerve stimulation is key to effective bladder management. The precise parameters of electrical stimulation, like frequency, intensity, and duration, play a significant role in how the bladder functions. These settings directly influence the neural control of the bladder, affecting both its ability to store urine and to void it properly. When adjusted correctly, these settings can help reduce symptoms such as urgency, frequency, and incontinence. On the other hand, if the settings are not appropriate, they may not work effectively or could even worsen the symptoms. Nerve stimulation, especially tibial nerve stimulation, is commonly used to treat conditions like overactive bladder. This condition involves involuntary bladder contractions that lead to a sudden urge to urinate and can result in incontinence. The tibial nerve is connected to the spinal segments that control bladder function. By stimulating this nerve, we can influence the pathways that regulate bladder activity. One of the main reasons nerve stimulation settings are so important is their ability to modulate bladder reflexes. For instance, using low-frequency stimulation, around 20 Hz, can reduce the number of bladder contractions. This helps improve the bladder's storage capacity and decreases urgency. Conversely, higher frequencies might have different effects. This frequency-dependent response highlights the need for careful selection of stimulation settings to achieve the desired therapeutic benefits without causing adverse effects. Moreover, optimizing treatment efficacy is crucial. Research indicates that about 50 to 70% of patients with overactive bladder experience symptom improvement when the stimulation settings are properly adjusted. The intensity of the current must be sufficient to activate the nerve without causing discomfort. If the stimulation parameters are inadequate, patients may not see any improvement. Long-term management is another critical aspect. Bladder conditions often requiring ongoing treatment, and the right stimulation settings help maintain symptom control over time. Some patients may need repeated sessions or maintenance treatments to sustain their benefits. Adjustments to the settings may be necessary based on how the patient responds and tolerates the therapy. Safety and patient comfort are also paramount. Properly adjusted settings can minimize side effects and discomfort during stimulation. If the stimulation is too intense, it can lead to pain or muscle spasms, which may discourage patients from continuing their treatment. Finding a balance between efficacy and tolerability is essential for successful therapy. Lastly, every patient is unique, and bladder dysfunction can vary in severity and underlying causes. Customizing stimulation parameters allows healthcare providers to address specific bladder dysfunction patterns. This is especially important for individuals who may be experiencing bladder issues related to bladder cancer treatments or surgeries. In summary, nerve stimulation settings are crucial because they determine how effectively we can manage bladder function. By carefully balancing symptom relief, safety, and patient comfort, we can optimize treatment outcomes. This is vital for anyone dealing with bladder dysfunction, including those affected by bladder cancer. Always remember to consult with a healthcare professional for personalized advice and treatment options.